Alrighty. If you hear any noise in the background, it's my roommates. There's not much I can do, but let's hope they aren't a problem. And gestures, nope. All right, so this is my presentation on the effects of binge drinking on the group of people being the college students. So, slide one. I'm going to talk about the effects of binge drinking on college students specifically. My research was focused on the key question of how does binge drinking affect college students? As you can see down here. And the central goal of this presentation is to show how binge drinking negatively impacts students' health and safety, highlight its long-term consequences, and encourage healthier choices and effective intervention methods, such as drinking less and talking to these students and whatnot. So the focus on this is health, safety, and long-term consequences. So what is binge drinking? It's important to actually define it first. Um, According to the National Institute of Alcohol Abuse and Alcoholism, binge drinking is if someone were to reach a blood alcohol concentration of 0.08% or higher. So for a lot of people, that's about five drinks, or at least a lot of men, it's five drinks or more. And for women, usually four or more. Things can differ depending on weight and height and things like that. There are also just there's a more extreme category, and it's called high intensity drinking. So they define that as eight or more for women and 10 or more drinks for men. And that's in just one session or just like one continuous time frame. Um, they say that this increases the level of risk for health consequences and yeah. Also, the binge drinking for five or four drinks would be within 2 hours as well. So the study type and the data sources would come from, well, the data that I collected and the study types that I used were cross-sectional observational studies using national data sources, including the National Survey on Drug Use and Health and research from the National Institute on Alcohol Abuse and Alcoholism. So these studies analyze trends in how often students drink, how intense they drink, and how these actions relate to health outcomes. The focus here was prevalence, frequency, and intensity of drinking for most of these. Um, and those are pretty effective in determining how risky it was to be doing these kind of behaviors. So, the key findings that we found in this research, that binge drinking has serious health consequences. It can increase the chances of or chances slash risk of liver disease, chronic illness, several different types of cancers, head, neck, esophageal, liver, breast, and it also contributes to mental health problems such as anxiety, depression, and risky decision making from the use of alcohol itself and its withdrawals. What makes binge drinking unique compared to many other health issues in America is it's actually not genetic or predetermined at all. It's a habit, and it can be changed. It can be affected. It can be stopped almost immediately. Um, there are a few cases in which someone of extreme alcoholism is not able to stop immediately, but for many cases of people such as college students, this is kind of the method, just going cold turkey if you are too far into this alcoholism. So it's an increased risk of liver disease, chronic health conditions, and cancers, but it also has mental health impacts such as anxiety and depression. So the statistics, the national surveys show that binge drinking is most common among college age population. Unsurprising considering how much college students like to party and how much time they have. Many students engage in it regularly. High intensity drinking is especially concerning in this age group, but it's concerning for all age groups. It's just more concerning for this age group considering the fact that they are the most common. Um, and these patterns reveal that alcohol misuse isn't rare at all. It's actually very widespread and causes a lot of problems. It's common in college age students, high intensity drinking. Mm, yeah, and there's a strong association with negative health outcomes. Safety risks beyond long-term health effects we've already talked about. Binge drinking can cause immediate damage to yourself, to others, you to others, and others to yourself. Um, some possible consequences are alcohol poisoning, injuries that are self-made, unsafe driving while intoxicated, assaults while intoxicated, and et cetera, et cetera. Um, um, yeah. So why this matters? Binge drinking is very negative for your mind and your body. And for someone who is trying to learn and someone who is trying to stay oh, stay very educated, this isn't necessarily a good thing at all. And indirectly increasing the likelihood of accidents is an unsafe behavior in and of itself. Just like you don't want to increase your risk of doing something stupid, you don't want to do something that will increase your risk of doing something stupid. So the first step is recognizing these risks and making healthier choices. So, in summary, binge drinking is a very serious issue among college students specifically, but also among every other age group. And the research shows clear links to chronic disease, cancer, mental health issues, and other safety hazards that we spoke about. But because it's habitual, it's not permanent, and students and anyone has the power to change it. It's just going to take some willpower. And by increasing awareness and encouraging and promoting intervention strategies, we can help reduce the harm caused by binge drinking on college campuses.